I'm Dr. Kareem Shariff, a gastroenterology research fellow in Cancer Cell Unit, Medical Research Council, Cambridge, United Kingdom. I would like to thank the GIE endoscopy for giving me this opportunity to talk on behalf of my co-authors about our original study titled Randomized Crossover Study Comparing Efficacy of Transnasal with Standard Endoscopy to Detect Barrett's Esophagus, so-called NOES, Nasal or Standard Endoscopy. The senior author and the principal investigator of this article is Dr. Fitzgerald, who also is the group leader of our unit. The work of our unit is focused on the clinical need to reduce the high mortality associated with Barrett's adenocarcinoma. Barrett's is the only recognized precursor of this cancer, and one of our main research aims has been to find tools to screen for Barrett's esophagus. Currently, the only available tool for screening is the standard gastroscope, which necessitates the use of sedation to make it tolerable to the patients. This increases risks, prolongs procedure, and requires monitoring. For a screening tool to be accessible to the general population, it should be easily available in the primary care setting. The technology that has made it possible for our cameras and mobile phones to become smaller and slimmer has also made our gastroscopes ultra-thin. This makes it possible for the endoscope to be passed through the nose rather than the mouth, making it more tolerable and obviating the need for sedation. Multiple studies have confirmed this feasibility and better tolerability, but there is limited evidence of its use for screening in Barrett's esophagus. In this study, we set out to evaluate whether these new generation ultra-thin scopes have the optical quality to detect Barrett's esophagus, and whether the biopsy taken through its narrow channel with pediatric forceps can pick up intestinal metaplasia when compared to standard endoscopes. At the same time, to confirm whether these scopes are better tolerated as suggested in previous studies. This study was performed in the Clinical Investigation Unit Research Endoscopy Suite of Cambridge University Hospitals, which is a tertiary referral center. In this well-designed, randomized crossover study, 49 of the participants had an endoscopic diagnosis of Barrett's esophagus on standard endoscopy. Transnasal endoscopy detected all but one, which was a 1 centimeter segment of Barrett's esophagus. Endoscopic Barrett's esophagus was confirmed to contain intestinal metaplasia in 34 of the 49 cases by standard endoscopy. Despite a significantly smaller biopsy size, transnasal endoscopy failed to identify intestinal metaplasia in only 3 of these participants, giving a sensitivity of 91% and specificity of 100%. Although not powered or designed to study dysplasia, there were 3 cases of dysplasia picked up by both transnasal endoscopy and standard endoscopy. The correlation of the length of Barrett's segment was excellent between the 2 procedures. The tolerability, as assessed by the validated State Rate Inventory Questionnaire and Visual Analog Scale, were similar for both the procedures. But 59% of the participants preferred transnasal endoscopy to standard endoscopy. Transnasal endoscopy could not be passed transnasally in 5 of the participants, 2 due to presyncopial episode and 3 due to narrow nasal passages. None of the participants reported nasal bleeding or significant pain. In conclusion, our study has demonstrated that transnasal endoscopy may be an efficacious, well-tolerated, and accurate screening method for Barrett's esophagus. Given that transnasal endoscopy can be performed without sedation, with minimal complication, and is feasible in primary care settings, further studies are now warranted to examine the clinical and the cost effectiveness of the investigation. We propose that this technology should be seriously considered for endoscopic diagnosis and screening of Barrett's esophagus, and further evaluation is warranted. Thank you for listening, and I hope you will enjoy reading this article in the GIE Endoscopy Journal.